Let us now learn about obturator nerve. Obturator nerve is the nerve of adductor compartment of thigh, that is medial compartment of thigh. It arises from lumbar plexus within the abdomen. Obturator nerve arises from lumbar plexus within the abdomen. It is formed by ventral divisions of anterior primary rami of L2, L3, L4 nerves. Ventral division of anterior primary rami of L2, L3, L4 spinal nerves. Obturator nerve arises from ventral divisions of anterior primary rami of L2, L3, L4 spinal nerves within the psoas major. It descends through psoas major and emerges on the medial border of psoas major. You can see it is medial border of psoas major. Obturator nerve emerges on the medial border of psoas major. It runs over lateral wall of pelvis and enters thigh by passing through upper part of obturator foramen. It enters thigh by passing through upper part of obturator foramen. Branches of obturator nerve. Within the obturator canal, obturator nerve divides into anterior and posterior divisions. Anterior division, it passes in front of obturator externus muscle and it then descends behind pectineus and adductor longus. It descends in front of adductor brevis. Anterior division supplies pectineus, adductor brevis, adductor longus, and gracilis. Remember the mnemonic gap G. Gracilis. A. Adductor longus, adductor brevis. P. Pectineus. It also gives a branch to hip joint. It also gives a twig to subsartorial plexus. Posterior division, it enters thigh by piercing anterior part of obturator externus. It then descends by passing behind adductor brevis and in front of adductor magnus. Posterior division supplies obturator externus, adductor brevis, adductor magnus. Its terminal part forms articular branch called genicular branch. Genicular branch supplies knee joint. Adductor brevis is supplied by both anterior and posterior divisions. Now let's revise obturator nerve. It arises from ventral divisions of anterior primary rami of L2, L3, L4 spinal nerves. It is the nerve of medial compartment of thigh. It gives anterior division and posterior division. Anterior division passes behind pectineus, adductor longus, and it passes in front of adductor brevis. It supplies pectineus, adductor longus, adductor brevis, and gracilis. It also gives an articular branch to hip joint. It also gives a twig to subsartorial plexus. Posterior division. It enters thigh by passing through anterior part of obturator externus. It then descends by passing behind adductor brevis and passing in front of adductor magnus. It supplies obturator externus, adductor brevis, adductor magnus. Its terminal part forms an articular branch called genicular branch that supplies knee joint. Anterior division supplies pectineus, adductor longus, adductor brevis, gracilis, and also gives a twig to hip joint. Posterior division supplies obturator externus, adductor brevis, adductor magnus, and it also gives an articular twig to knee joint. Adductor brevis is supplied by both anterior and posterior divisions of obturator nerve. Clinical correlation of obturator nerve. As both the hip joint and knee joint and hip joint are commonly supplied by obturator nerve. Hence, disease of hip joint may cause referred pain to knee. Spasm of adductors of thigh in spastic paralysia are relieved by surgical division of obturator nerve.